Welcome to the channel. So in the series D.ed Special Education IDD first paper, Introduction to Disabilities, today we are going to start the fourth subtopic of our first unit, Understanding Disability. So we have already covered the first three topics in our previous videos, so check those out and don't forget to like and subscribe. So we will start with our fourth topic. So our fourth topic is an overview of causes, prevention, prevalence, and demographic profile of disability, national and global. Prevalence of a condition or disability is determined by epidemiology. Epidemiology is a science concerned with the study of factors that influence the occurrence and distribution of disease, defect, disability, or death in aggregation of individuals. Epidemiology involves making a determination or estimate of the number of cases of some condition in a population. In addition, it attempts to relate this estimate to other classification of population such as age, sex, and social class. A good epidemiologist depends upon the definition of the condition in question. If the condition is poorly or vaguely defined, there will be a problem with the estimates of its occurrences. An epidemiologist uses two methods for estimating the occurrence of a condition in a population: the incidence rate and the prevalence rate. Difference between incidence and prevalence. Incidence refers to the number of new cases in population during a specified period of time. Prevalence refers to the total number of cases in a population group during a specified period of time. As per the census 2011, the differently abled population in India is 26.8 million. In percentage terms, this stands at 2.21%. There has been marginal increase in the differently abled population in India, with the figure rising from 21.9 million in 2001 to 26.8 million over the period of 10 years. As per the census 2011, there are 14.9 million men with disabilities as compared to 11.9 million women in the country. The total number of differently abled people is over 18 million in the rural areas and just 8.1 million enumerated in the urban settings. The percentage of men with disabilities is 2.41% as against 2.01 in women. Social groups wise analysis shows 2.45% of the total disabled population belongs to the scheduled caste, 2.05% to the scheduled tribes ST, and 2.18% to the other than SC/ST. About 15% of the world's population lives with some form of disability, of whom 2 to 4% experience significant difficulties in functioning. The global disability prevalence is higher than previous WHO estimates, which date from 1970s and suggested a figure of around 10%. This global estimate for disability is on the rise due to population aging and the rapid spread of chronic diseases, as well as improvements in the methodologies used to measure disability. A few outstanding figures of disability around the world, according to the WHO's 2011 report. 253 million people are affected by some form of blindness and visual impairment. This represents 3.2% of the world's population. That's twice Mexico's population. 466 million people have a disabling deafness and hearing loss. This represents 6% of the world's population, that is to say, all of the inhabitants of the European Union. About 200 million people have an intellectual disability, IQ below 75. This represents 2.6% of the world's population. It covers the number of inhabitants in Brazil. 75 million people need a wheelchair on a daily basis. This represents 1% of the world's population, that's twice Canada's population. These statistics may remain an evolutionary average, but one thing is certain: The number of people affected by any form of disability represents a significant part of the world population, from children to adults alike. It is also important to underline the fact that some people may have multiple disabilities. This explains why the total number of people with disabilities in the world isn't equal to the sum of people with disabilities per disability type. Indeed, the same person can be both deaf and blind. Causes: risk factors for the disabilities: communicable diseases, infectious diseases such as lymphatic filariasis, tuberculosis, HIV/AIDS, and other sexually transmitted diseases. Neurological consequences of some diseases such as encephalitis, meningitis, and childhood cluster diseases such as measles, mumps, and poliomyelitis contributes to disability. Non-communicable diseases (NCDs). Chronic diseases such as diabetes, cardiovascular disease, arthritis, and cancer cause the majority of long-term disabilities. The increase in NCDs observed in all parts of the world will have a profound effect on disability. Lifestyle choices and personal behaviors such as obesity, physical inactivity, tobacco use, alcohol consumption, illicit drugs that lead to non communicable diseases are also becoming major contributing factors. Air pollution, occupational disease, poor water supply, sanitation, and personal and domestic hygiene, malnutrition also contribute for disability. Injuries due to road traffic accidents, occupational injury, violence, conflicts, falls, and landmines have long been recognized as contributors to disability. Mental health problems. Mental health retardation and mental illness are the causes of mental disability. In more than 50% cases of mental retardation has been reported to be caused by serious illness or head injury in the childhood and birth defects. Mental retardation was observed mostly at birth or at very early ages of life, while the problem of mental illness is more of an old age problem. Those with lower educational levels, lower incomes, and those who are unemployed were also more likely to suffer a disability. There is higher risk of disability at older ages. Prevention of disabilities. Primary prevention. Action taken prior to the onset of the disability, which will remove the possibility that a disability will occur. Secondary prevention. Action which halts the progress of the disease or disability at its incipient stage and prevents complications. The specific interventions are early diagnosis and adequate treatment. Tertiary prevention. All measures available to reduce or limit impairments and disabilities and minimize suffering caused by existing disability. This phase is also called rehabilitation, which includes physical, psychosocial, and vocational measures taken to restore the patient back to normal or near normal condition. It is extremely important that the women undertake adequate and effective preventive measures during their pregnancy and immediate postnatal period and also for their children, especially during the early childhood period. In order to significantly reduce the incidence of impairment and disabilities in them. Therefore, in this chapter, examples of easily understood primary preventive measures for mother and child are summarized. General preventive measure. Marriage between very close blood relations like uncle, niece, first cousin should be avoided for prevention of hereditary disorders. Avoid pregnancies before the age of 18 years and after the age of 35 years. Consult a doctor before planning the pregnancy. If there is incidence of birth defects in your family, if you have had difficulty in conceiving or have had a series of miscarriages, stillbirths, twins, delivery of operation, cesarean, obstructed labor, prolonged labor, more than 12 hours and or severe bleeding in previous pregnancy. If you have Rh negative blood type, if you have diabetes, care during pregnancy. Avoid hard physical work such as carrying heavy loads, especially in fields and other accident-prone activities such as walking on slippery ground or climbing stools and chairs. Avoid unnecessary drugs and medications, even though normally considered safe drugs which are sold commonly can potentially cause serious defects in an unborn child. Avoid smoking, chewing tobacco, consuming alcohol and narcotics. Avoid X-rays and exposure to any kind of radiation. Avoid sexual contact with a person having venereal disease. Avoid exposure to illnesses like measles, mumps, etc., especially during the first 3 months of pregnancy. Take precautions against lead poisoning. Avoid too much use of sirma or coal. Eat a well balanced and nourishing diet supplemented with green leafy vegetables, proteins, and vitamins. All women of the childbearing age need 0.4 milligram of folic acid daily. It is also available in folic acid plus iron tablets, which should be taken for at least 3 months during the third trimester when the risk of developing iron deficiency anemia is greatest. Ensure weight gain of at last 10 kgs. Have regular medical checkups. All pregnant women should be given tetanus injection. Women at high risk whose weight is below 38 kg, height is less than 152 cm, weight gain during pregnancy is less than 6 kg or who is severely anemia C, hemoglobin less than 8 milligram, having frequent pregnancies, having a history of miscarriage, abortion, premature deliveries must get expert prenatal care so as to have a normal baby. Must consult a doctor in case of edema, swelling of feet, persistent headache, fever, difficulty or pain in passing urine, bleeding from vagina, and yellowness of eyes, jaundice. Care at the time of birth. Delivery must be conducted by trained personnel, preferably in a hospital where all facilities are available. If baby does not cry immediately after birth, resuscitation measures should be undertaken at once. Babies born prematurely with low birth weight below 2.5 kg may need neonatal intensive care. If the baby's head appears to be abnormally small or large, then a physician should be consulted, preferably a pediatrician. The approximate head size for a male child at birth is 35 cm and for a female child is 34.5 cm. To protect a child from infections, breastfeeding must be started immediately after birth. First milk colostrum must be fed to the baby and should not be thrown away as it has antibodies which are protective. Early childhood care. Do not allow a child's temperature to rise above 101 degree Fahrenheit because of any reason. It can cause febrile seizures. If a child gets a fit, take him to doctor immediately. Every child should be immunized against infectious diseases as per the recommended schedule of immunization. Do not allow a child to have too much contact with paint, newsprint ink, lead, etc. as they are toxic. Take precautions against head injury and other accidents. Ensure that the child gets a well-balanced diet and clean drinking water. Introduce additional foods of good quality and in sufficient quantity when the child is 4 to 6 months old. Vitamin A deficiency and its consequences, including night blindness, can be easily prevented through the use of vitamin A supplementation. Protect a child from meningitis and encephalitis by providing a hygienic environment which is free of overcrowding. Common salt must be iodized as a precaution against goiter and cretinism. Do not allow a child to use hairpins, matchsticks, and pencils to remove wax from their ears. Use ear protectors to reduce the exposure of high level of noise if children are living or working in a noisy environment. Do not slap a child over the face as this may lead to injury of the eardrum and consequent hearing loss. So that was the fourth topic of the first unit, and we will start the fifth topic, concept, meaning and importance of cross disability, in our next video. So stay tuned for that. Don't forget to like and subscribe, and thanks for watching.